welcome back to Open Your Eyes, and we're now moving into our final segment for the morning. And today is actually World Health Day, and that's exactly where our conversation will be surrounding. In to talk to us, we've got Dr. Jorge Polanco. He is the public health consultant, and also Robyn Daly, nutritionist of the Ministry of Health and Wellness. Guys, good morning and welcome.
Good morning, good morning.
Good morning.
Yeah. Well, it's great to see both of you again and to be able to talk about this very critical topic. We have been speaking so much about COVID and about the pandemic that we mustn't lose sight of the other great threats that we have to our health. So let's start with that before we move into the perspective of front label packaging. When it comes to non-communicable diseases, the diabetes, the hypertension, the cardiovascular diseases, the obesity, how bad are we and how worrisome is the situation? Dr. Polanco?
Yeah, indeed it is a very serious public health concern, these topics that you made reference to, and that is the bottom line why we will be speaking of this front of package labeling this morning. Diabetes, hypertension have been leading causes for hospitalization over the last 30 years here in Belize, and it continues. We have obesity now that has been added on, leading to some chronic problems. And then we recognize it has to do with a poor nutrition.
Yeah.
So that is what gave rise to this topic. It's a global topic, but the Americas has been pushing it over the recent years to look at the labeling of the food with the sole objective of informing consumers as to what is healthy and what is unhealthy.
Yeah. And speaking of the pandemic, and I'd like to go to Robyn with this one. You know, it was only so much that families could afford, and more so, the first thought in mind is not to get food that will eventually spoil tomorrow or put it in the fridge for a little while. It was food that must be preserved for a long time. I can remember at the start of it, people flocked to the stores because they didn't know what to do. We didn't know what to have in the household. What are your thoughts on this? And with respect to health and safety, how does this affect us?
You brought up a couple interesting points. Looking at food security is one, having people have access to healthy food, looking at ways to get food that will help to minimize the prevalence of diseases such as diabetes, obesity, hypertension, etc. We have always been advocating for healthy eating, but I think looking at going through this pandemic, it has become a challenge for most people because in some cases, people just want food. People just have a need for food and they ignore the nutrition component, which again can put people at risk for having a higher prevalence of diseases or poor management of disease. So it makes our work actually here at the ministry and us health professionals advocating a little bit harder, because if you are in a family and you've lost your job or the breadwinner of the home doesn't have a job, it's hard to focus on nutrition and healthy eating when you just need to have a need for food. So I think this is a very good time since it's World Health Day, and also it gives us an opportunity to focus on prevention of disease and also better management. So we also have a way to look at what are the foods that we're eating? How can we make better decisions with the little that we have? What are some small steps we can do to make sure and ensure the family is eating better and we're putting ourselves in a position where we're not we're not actually causing more illness, but we're preventing illness from occurring.
In the Caribbean especially, and moving into the conversation about food labeling, the bigger concern is, while we can always talk to adults about changing their diets, it's about the children. We know that, I think, you guys can correct me, isn't it 1 in every 3 Caribbean children that they're either overweight or obese?
Yes.
Yes.
Yeah. So they're starting off already facing what is considered now a lifestyle disease. And then you look at our adult population where 2/3 are either overweight or obese.
That is correct, yeah. And it's true for the Caribbean and Central America, so for the entire sub-region.
Yeah. So it means we have to make healthier choices as early as possible.
Yeah, that's a challenge, and that's one of the underlying objectives of this campaign.
Yeah.
To really inform the public as to the rationale of the messages that they will be seeing, of the symbols that is expected to be on the products.
Yeah.
Maybe, Marlene, if you agree, let me just share in a few seconds the background to all these campaigns, as a general information.
Yeah, well, I wanted to get to that because we have already signed on. We've already signed on to agreeing to implement front label packaging, and this is a regional movement.
Yes, yes, it is a sub-regional initiative.
Yeah.
And right now, the policy level, or at the level of the heads of states and the ministers of health, in this case, are currently discussing it. It is something that have been in discussion for the past 5 years at the level of PAHO, WHO. But right now, over the last 3 years, it has gained momentum, and currently, it's on the desk of the ministers of health and of the ministers of human development and social services.
Yeah.
And it should also form part of the agenda of the ministers of trade at the CARICOM level. So that is where it is right now.
Yeah, yeah. And Robyn, when you talk about, the food that children will naturally gravitate to, any part of the world, but of course here in Belize we know that, it's gonna be the ones that probably are packed with all the things that you don't want them to be packed with. Sugar, salt.
Fats.
Yeah.
So we try to, we're actually working together with the Healthy Caribbean Coalition branch in Belize to launch some campaigns, and the campaigns that we're going to launch is going to influence children. We want them to be child friendly, and also working along with the Ministry of Education. So as schools open, I think before last year, we were in the process of looking to initiate and discuss how we can have a sugar ban in schools. It's not finalized. It was just a discussion that had started, and we were looking at having more education and actually more intervention in schools where children are more exposed to unhealthy food. So we're hoping that once these get launched, it can collaborate and also help to push this front of package labeling and also healthy foods.
Yeah. And I think that's a great initiative. But I'll tell you one of the things that's plaguing households at this point. Parents are at home. The children are at home. The parents are at home working, but they need the children to eventually lessen when it comes to noise. So they're given a tablet and they're given comfort foods to not make noise. So what can we do within the households to at least try to get this lesson rather than to have these things as comfort foods?
Educate. We have to come up with innovative ways to educate parents and to make it more fun for children as well, because it's a tough time for everyone, and ideally you would resort to comfort foods and also rewarding children with junk foods. For them to be still or to do their chores or whatever it may be. But we have to continue our campaign and to inform parents, inform all our stakeholders that these comfort foods, these junk foods, these unhealthy foods are really doing more harm than good, especially if physical activity is not included. And this can only be done with proper education and having creative campaigns. There are many campaigns that we can do, having healthy snacks, having children prepare healthy snacks, have healthy foods in the household, and it doesn't have to be expensive either. So these are some of the ways, but it won't happen as a one time, because we've been trying for a while to get these foods out of schools and trying to educate principals and having them on board in terms of having healthier options in schools. And the same things have to be in the home, because sometimes we as adults, we enjoy these foods as well. But when we're looking at the long-term effects, looking at the high levels of obesity in children, the high levels of NCDs that are rising right now, we have to look at how can we prevent this and look at it as a collaboration with all of our stakeholders.
You know, it's so difficult, especially even if a parent is trying to be health conscious. I know, Robyn, we've had many conversations about this where people just say healthier on their packaging, or this is healthy and that is healthy. And when you really look at the ingredients list, you realize it's not so healthy after all. Is this, what's the research saying about these particular labels being placed specifically on the front of packages? Do we know if it's going to be helpful, if it dissuades parents from buying these things for their children?
There has been many research that has been done since the front of package labeling has been introduced. I know research has been done as recent in the Caribbean island of Jamaica. We also have research been done in South America, Chile, Peru, also our neighboring country, Mexico. So we've seen that this octagon-shaped label has been labeled as the most effective way to get messages across and to have a positive impact in healthier eating. Yeah. Of course, over time, we will see these over a couple of years, the actual big effects. But so far, the research has shown with countries that have implemented it as legislation already, that it has made an impact and persons are choosing healthier options. They're choosing less sugary foods. They're actually eating healthier.
You know, I'm sure it's difficult to be able to change just the cultural patterns, the traditional patterns of what children should eat. You think children and snack and you think junk food. And this is kind of the change that has to happen. Where are we in being able to move forward with the type of policies and legislation? Because when you talk about the research saying this works, it should be an easier sell. Just as we know sugar tax works in other parts of the world in declining the consumption of sugar-sweetened beverages. Yeah. Where are we in being able to take a proactive approach on NCDs?
In regards to the front of package labeling, we are going to be pretty close to having it implemented, just due to the fact that our foods that we import are developing legislation for it. So we, almost by default, we will, these labels are already in stores in Belize, by the way. So it's already in the market, and with CARICOM doing their final voting process, we're gonna see also this being legislation for the Caribbean. And those are our neighboring countries where we do our food trade. So we will have these labels in stores and we will have them in the market. So our best advantage is to join on. There is enough evidence to support its effective use, and also educating our public on, it's a good time also to educate on nutrition, because if you're shopping and you see these labels, it will create some questions. You might want to look closer to see what it's saying, what it means, and our campaign is going to be in line with promoting healthy eating. So you're going to see it in the stores, and with the campaign, we're hoping that we are going to be right on board with the rest of our neighboring countries in terms of advocating for this and seeing the effects in future years.
And so looking at being able to convince people to make healthier choices, I'm sure you're both aware of what the first concern is. Healthier food is going to cost more money. How do you respond to that?
Doctor, you want to jump in on this one?
Well, you know, that is something that you would always hear. But when you think on it, the nutritionists are very good in educating and informing and in displaying recipes where you can prepare food, healthy food. You can prepare it at home. And when you look at the cost, it's indeed not greater than what is being than what is being informally shared, that it is expensive.
Yeah.
So that is a challenge. There will be a need to really educate and inform as to how to prepare healthy snacks. Along with the Ministry of Health, a menu was developed, a school feeding program menu was developed about 2 years ago, 3 years ago, whereby using food that is available in Belize, the cooks can prepare healthy food, and it really did not increase the budget of the Ministry of Education. And this is true for the general population. The consideration is this: investing in healthy food will have its impact at a very short term, because children would remain healthy.
Yeah.
Young people will remain healthy. Persons who already have maybe diabetes or hypertension or some other nutritional related a disease, complying with their medications and their diet, the risk of them having complications will be much low.
Yeah.
And by that I mean the risk of having getting blind or amputating a limb is lower. So there is a cost in investing, but it's not really what is perceived out there. Marlene, just to add to what Robyn said in regards to your previous questions as to the policy status, this campaign comes as part, or one of the objectives is to promote what is being discussed at the policy level right now.
Okay.
Currently at CARICOM, all the countries are discussing the topic. Some have already expressed their positions. Belize has not expressed its position as yet. And this campaign, one of the objectives is to really educate the entire population, for them to know what's the rationale of this campaign, what it means, what's the underlying objectives, which in a nutshell, it is simply to inform consumers. So once the countries of CARICOM approve it, and it is expected that once 75% of the countries approve it, then the initiative will be presented to the Ministers of Economy and Trade of CARICOM. Then they will review it also, and then they will have a final say. So it is not expected that all countries approve it, but at least 75%. So then what this means is that once the Ministers of Economy and Trade or Investment approve it, then the countries will begin to work on bills and laws that will ensure that the manufacturers put those labels in front of the package. In the case of Belize, we import a lot of our food products, but the exporting countries like the Caribbean, Mexico, Central America, they will be complying. So those labels
will automatically benefit.
Will be coming into Belize. So then our main function as of now is to be informing the public as to what that means. So when they go to the supermarket and they pick up a product, they would know exactly what those symbols mean.
Yeah. And tell us, Doc, because especially since the focus has been, we talk about NCDs in general, but when we talk about children and when they have this predisposition for obesity or being overweight or eating unhealthy foods in excess, what happens as they grow? Why do we need to start with them in childhood?
Okay, yeah, very, very important question. There is a research that shows that once a child reaches the age of 5, as an obese child, the likelihood of him or her developing chronic diseases as a young adult is very high. And these have been the results of studies of cohorts that have been done in Europe and in South America. So it's not that we are saying, okay, you are obese now and it's okay when you are adult, it will be fine. No, the likelihood of having diabetes is much higher. So then the challenge that we have as a country is to really educate the children. When you brought up the issue of the children having access to unhealthy food at homes as a comfort, That's one of the realities that needs to be addressed. The parents need to be informed, and then the parents need to take decisions. The other, I would say, good thing about it is that children learn very, very quick.
That's true.
Yeah.
You tell them once, and if they get the message, believe me, they will retain that message.
Yeah.
So that is the reason why, along with the Ministry of Health, PAO has been working with the Ministry of Education to strengthen the nutrition curriculum within the primary schools. And the objective is for the teachers to be able to teach the children what is healthy food, and for them to be able to recognize what is unhealthy.
Yeah.
So if we get it at this stage, those children should learn, and it is expected for them to follow the advice of their teachers. They will follow healthy behaviors in regards to what they consume.
Yeah.
On the long run, they will become healthy adolescents, and they believe it, by then it would be a culture already, and they would be able to know what's unhealthy, what could be eaten, what should not be eaten.
Those are skills for life. You know, Doc, as
That
you
is
said,
correct.
as you said that children learn and adjust easily, I can't help but think a year ago we thought children would never wear masks. I don't know what your experience is, but now they are part of the mask police.
Yes.
You know, they remind you to put it on, they'll put it on because they adapt once they learn and understand.
Yeah.
So it is
That
a
is true.
lesson.
That is true.
It is a lesson indeed. The same with washing hands. So
Yeah.
they are indeed sponges. But I'll tell you what,
You
Doc.
know-
Sure, go ahead.
My granddaughter is 7 years old. If she comes to my house, she asks, before I hug her, she will say, in Spanish, right? Have you washed your hands?
Uh-huh.
Or if I go to her house, I cannot go close to her unless I wash my hands properly.
Yeah.
And she is serious. So that's just an example of how they learn what they
In
are
just
taught.
1
And
year.
the same thing applies for food.
Yeah.
There has been research at the level of Central America whereby children take home the messages that they learn in school in regards to what is healthy food. And it is these experiences that have provided a positive feedback to continue strengthening the nutrition curriculum, because they have done surveys whereby they see children go back home with this information.
Yeah.
Absolutely.
So in wrapping up, guys, and Robyn, when we go to the stores, especially as parents, what should we look for so we could keep a healthy lifestyle and a balanced diet within the household?
You want to look at food products that have the octagon shape. If you see a food product having an octagon shape, and it's normally in the far right hand corner of the food product, once you see many, you already know that's an unhealthy food. But once you see one, it's indicating that that food is either high in fat, it's either high in sodium, or it's either high in sugar. And many times, this front of package labeling has also put a block on having like cartoon characters and things like that on the snacks, which would attract children.
Yeah.
So looking at extra, the shapes, the octagon shapes, those are the ones that you want to look out for. And if you see 3, 4, 2, you already know that that food is high in either sugar, fat, or if you're seeing more, it might be high in all. It might be high in fat, sugar, and salt.
Yeah.
And you already know that that's a food that's unhealthy for you. And research has shown that many times this new label allows consumers to pick up items quickly and make a decision fast. And the old method you would have to turn to the back. You'd have to look at zoom down. So now once you look at the front and you see these labels at the top, you already know this is an unhealthy food. And as the image is showing that you're showing there's actually 6 that you could actually see. So if you're seeing 1, it's already not a good option. And if you're seeing 3, 4, you already know that is definitely not an option for you to pick up, because it's very unhealthy. It has in these ingredients that would be able to put you at risk for health diseases.
So today there's going to be a webinar to help people understand more. Give us the details on that.
Well, the webinar will be, I think it's 9. I'm not sure the Eastern Standard Time. I think it's 9 for us here in Belize. It's 9 to 10:30, so it's an hour and a half, and it's really sponsored by the Healthy Caribbean Coalition in collaboration with the Pan American Health Organization and also UNICEF. And just to add also, the president for the Healthy Caribbean Coalition here in Belize, we will be supporting them, all of our stakeholders, in launching this campaign. So you'll be seeing many ads, you'll see posters, you'll be seeing many campaigns, social media that will be, and it will be adapted to our Belizean culture as well, for us to be sharing and joining the Caribbean community in launching this campaign to encourage healthier food options and creating an awareness for these labels that will be shown on these food products. So the webinar will be an awareness webinar to show the need for this initiative to be within the Caribbean, because like we mentioned, it's in Mexico already, and it's in many parts of South America, like Chile and Peru. They have already had it for years. And now we want to make sure that it's in the Caribbean, knowing that our population is facing serious challenges with NCDs, including our children. We want to be able to jump on board and join the campaign, and also advocate for this initiative to be within our Caribbean community.
All right. And Doc, final words are yours. What's your advice to parents and to the public on a whole?
Yeah, I think it's extremely necessary to have this campaign to inform the public, because the products will or have already started trickling into the supermarkets, into the shelves. And then if the initiative is approved during the course of this year at the level of CARICOM and Central America, then more products will be coming with these icons, with these symbols. And then it is necessary for the public to know what that means. There has been research also that a person would take between 6 and 11 seconds to look at an item and to decide if he or she will buy that item, whether for X reason. So within that period, 6 to 11 seconds, it is necessary for them to know then if that food is healthy or unhealthy. So that's another reason why the symbol, the octagon, has to be very clear, and it has to be in front. And there's something else to complement what Robyn said. All the icons, the octagons, if it has more than one, they should be side by side. So it's not that the one icon will be put on the upper right and the other one on the upper left and the other one to the lateral. No, all of them have to be side by side. In that way, the consumer will know this food is healthy, or if it has no icons, it is healthy. If it has one or more, well, the more it has, the more unhealthy it is. So immediately the consumer will say, I will buy or I will not buy.
Okay. Fantastic. And then
just as a final thing, the impact that I foresee on a short term is that the public of Belize would be informed, would make healthier, because this campaign has to continue throughout the year as to what is healthy food. And then the expectation is that people will change their behavior. On the medium term, there will be a decrease of those risk factors that are the result of unhealthy food. And on the long term, there should be a decrease in these chronic diseases. But of course, the challenge is to break that culture, that behavioral pattern that Belize has had or has in regards to the consumption of unhealthy food.
All right. And we should start to do that now. Start to live a healthy lifestyle. Dr. Jorge Polanco, Robyn, Daly, thank you guys so very much for joining us this morning, and do enjoy your day.
Thank you.
Thank you. You too.
All right. We're about to take our final break for the morning. When we come back, we will be wrapping things up. So stay with us. We'll be right back.